Honourable Finance Minister, Government of Bangladesh, Honourable Minister of Health and Family Welfare, Government of Bangladesh, Vice Minister, National Population and Family Planning Commission, Government of China, Honourable Minister and Deputy Chairman, National Planning Commission, Government of Federal Republic of Nigeria, Honourable Vice President and Secretary of State, Republic of Gambia, Secretary PPD and DG and CPD Kenya, Executive Director PPD Kenya, Excellencies, ladies and gentlemen. There are very few countries in the world whose destinies are so intentionally interlinked as India and Bangladesh. We share common cultural, economic and political history. We also share the longest land borders with each other. Many of us have the same religious beliefs, language, customs and aspirations. These are factors which encourage cooperation in every possible area. The recently concluded year-long joint celebrations of 105th birth anniversary of Gurudev Rabindranath Tagore are a testimony to our shared cultural ethos and heritage. Excellencies, today it gives me great pleasure to be here in Dhaka to attend the International Conference on Evidence for Action, South-South Collaboration for ICPD Beyond 2014, organized jointly by the Partners in Population and Development and the Government of People's Republic of Bangladesh. As Chair of PPD and on behalf of all the board members of PPD, I extend a warm welcome to all for taking time and traveling and to visit this most beautiful city of the country. My heartful thanks to the Government of Bangladesh for assistance provided for organization and hosting PPD. Excellencies, ladies and gentlemen, on the 20th anniversary of ICPD and the deadline for achieving the Millennium Development Goals approach, governments across the world have renewed their commitment to the ICPD program of action, and there is a renewed focus on population stabilization. The visionaries who forged ICPD have much to be proud of. Impressive achievements have been made since ICPD in 1994, with worldwide reduction in fertility rate, increased contraceptive use, and slowing of population growth rate. It is encouraging that global total fertility rate has fallen from 3.2 in 1994 to 2.4 in 2012. However, there is a great variation across countries from 1.1 to a high of 7.1. In PPD member countries, the TFR ranges from 1.5 in China to 6.3 in Mali. Friends, statistics reveal that 867 million women of children-bearing age in developing countries have a need for modern contraception, out of which only 645 million have access to them. Thus, a staggering 222 million women have no access to contraception. I note with a great concern that every year an estimated 10 million girls across countries get married before 18 years of age. Early marriage remains a challenge for many PPD countries, including India. In addition to this, adolescent boys and girls have poor access to information and services on sexual and reproductive health. This further compounds the problem. We have to work with renewed vigor in removing obstacles of provision of family planning services, whether these are related to availability of information, commodities and services, or to do with economic circumstances and social constraints. Excellencies, ladies and gentlemen, the renewed focus on family planning and its repositioning globally is a very welcome development. I wish to emphasize that the family planning is central to improving health outcomes. I am very happy to share with you that at the recent London Family Planning Summit, some of the PPD member countries made encouraging commitments. There was a discussion on how to make those commitments a reality through South-South cooperation. I assure that the PPD as an organization intends to push this agenda forward. Distinguished guests, in India, under the National Rural Health Mission, we have already brought about a paradigm shift in our approach to family planning. Our key strategy is to promote and provide spacing methods, considering that 45% of our maternal deaths occur in the age group of 15 to 25 years age. 47% of our total fertility is also clustered in this age group. In order to promote wider health benefits and well-being, we are moving away from limiting to delaying and spacing. Contraceptives are being made available at the doorsteps through 800,060 community health workers. There's a great push forward ensuring availability of ICPD services on fixed days at 1.5 lakh rural health sub-centers at the community level through 200,000 strong workforce of auxiliary nurse midwives. There is an emphasis on providing postpartum ICPD services in public health facilities. More than 12 million of our women give birth in public health institutions alone. Our efforts have yielded results. India has witnessed the steepest fall in growth rate since independence, 17.64% decadal growth during 2001 to 2011. Ladies and gentlemen, India is committed to ensuring that family planning, information service, and commodities are provided absolutely free to every client in every nook and corner of our large and diverse country. We have already developed indigenous capacity in public and private sectors to manufacture the entire range of family planning commodities. Many of these are now being exported. We recognize the challenge of unmet need, and in India, family planning is a central part of our efforts to ensure universal health coverage. As part of our universal health coverage, we are also according the highest priority to maternal and child mortality, which are the gravest among poor and vulnerable population. Equity and quality are the cornerstones of our strategy. Ladies and gentlemen, this international inter-ministerial conference is aimed at providing a platform for PPD member countries and other key stakeholders to discuss and create a southern consensus and commitment, both financial and political, for the post-2015 development framework. The outcome of conference will be a declaration adopted by the ministers of developing countries, which will reflect the views and recommendations from southern countries and other stakeholders, which will contribute to and lay the foundation for planning of ICPD beyond 2014 and also MDGs beyond 2015. Friends, before I conclude, I once again thank the government of Bangladesh for hosting this conference. Thank you very much.